Platelet-rich plasma, also known as PRP, is getting very popular these days. You hear of some people having PRP facials, some people getting PRP injections into sites of old injuries, or just doing it as kind of a prophylactic anti-aging treatment. And then you have people who are doing it for restoring hair or promoting hair growth. And so platelet-rich plasma, this is the first word is platelets. So platelets are a component of the blood that, along with the red and white blood cells, form up your blood, what you see in your veins. And so when a person has a cut or wound normally, these platelets are kind of the body's first healing response. And they arrive and they help stop the bleeding and start to promote the healing. And so when you are doing PRP, they'll take out your blood, they'll spin it in a centrifuge to separate out these components, and they'll be able to just take this platelet-rich plasma and use that for whatever purpose. Maybe it's injecting it somewhere, maybe it's putting it in the face, maybe it's putting it in the scalp. And that's because this platelet-rich plasma contains a wide range of growth factors and proteins that can help with healing and with tissue repair. And so when we look at the hair, some types of hair loss can be resulting from damage to the hair follicles. And researchers initially hypothesized and have kind of been proceeding on this hypothesis that PRP could help regrow hair by reversing the damage that caused this androgenetic alopecia to occur in the first place. So it's considered generally a promising treatment, but when they've done like just a couple small studies on it, the general consensus has been that because various researchers and clinics have different ways of preparing it, they have different intervals between the sessions, different total number of sessions, and different injection techniques to administer the PRP, the effects can vary. So there's not one standard industry-wide accepted approach to this is how you do it because it's been studied this specific way and that's optimal. So results can vary.